Hi everyone, I'm Dr. Alejandro Castro. Welcome back to another episode of Vet Board's preparation series. Today we're breaking down a NAVLE style question involving a green iguana with metabolic bone disease or MBD. So we have a 10-month-old male green iguana that presents for lethargy, a swollen, soft lower jaw, and difficulty lifting its body. The iguana is housed in a glass enclosure, fed fruits and mealworms, and has a full spectrum UVB light sitting on top of the glass. This is a representation of what the enclosure looks like. And this setup should already raise some red flags. This is exactly how these questions work on exams like the NAVLE. You recognize the disease immediately, but that's not what they are testing. The question isn't what the disease is. The question is why it's happening. So the question in this case is, what is the primary pathophysiology of this condition? So here are the possible answers. Pause the video and read carefully. So we have A, renal secondary hyperparathyroidism caused by chronic kidney disease from a high protein diet. B, nutritional secondary hyperparathyroidism due to inadequate UVB exposure from filtration by glass. C, hypervitaminosis D leading to osteopenia and soft tissue calcification. And D, primary hyperparathyroidism caused by a parathyroid adenoma. Okay, so the correct answer is B. And here is why. In reptiles, especially iguanas, UVB light is not optional. They need UVB to synthesize vitamin D3 in the skin. Vitamin D3 is what allows calcium to be absorbed and used properly. So here's the key mistake, and let's go back to that picture. So the glass that we had in the enclosure is blocking UVB radiation. So even though the owner has a UVB light, it's completely ineffective when it's placed over the glass. Now, if we add a poor diet, fruits, and mealworms, which are low in calcium and high in phosphorus, so what's going to happen is the blood calcium drops. And the body responds by releasing PTH or parathyroid hormone, which pull calcium out of the bones to maintain those normal blood levels. And that's how you end up with fibrous osteodystrophy, soft bones, swollen jaw, weakness, classic metabolic bone disease. So quickly on the other options. Renal secondary hyperparathyroidism occurs later in life. Hypervitaminosis D causes soft tissue mineralization and not necessarily a rubber jaw. And in case of D, the primary hyperparathyroidism is rare in reptiles and not the classic presentation. And remember, calcium levels can look normal even in severe metabolic bone disease. Think of calcium as bricks and vitamin D3 as the delivery truck. So if the UVB is blocked, the truck never shows up, no matter how many bricks you have. And this is one of the most common exotic cases you will see when husbandry goes wrong. Okay, well, if you're preparing for the NAVLE, the BCSE, the ECFVG, make sure you're comfortable with these scenarios. Subscribe for more real-world board preparation, and I'll see you in the next episode. Have a nice one.